But first, all new at 6, broken trust. Brand new details from the Ohio Department of Health on compliance issues at University Hospital's fertility clinic. Issues that were discovered after the failure that dashed the dreams of more than 900 patients and their families.
Well, the new survey also outlines UH's plan to correct the issues, and it's apparently enough for the state. News 5's Tara Molina has been investigating this from the start. And Tara, what does this mean for the hospital's future?
Well, Danita, the standout here is they are rescinding the decision they made weeks ago. It made quite a splash that would have taken away University Hospital's participation in Medicare. This basically says with the correction plan they have in place, they're back in compliance. This letter, a plan of correction submitted to the Ohio Department of Health after the department surveyed UH, finding deficiencies and compliance issues, including, quote, the standard is not met as evidenced by staff interviews, observations, and record reviews. The facility failed to ensure one liquid nitrogen storage container used for egg and embryo storage was inspected and maintained. Some other details? There was no documented evidence of cleaning or inspection of the storage container, which included calibrating and testing of high and low alarms, checking for leaks and electrical wires to make sure they are free of damage. And there was only one designated contact off-site in the event of an alarm. There should have been 3, as recommended by the manufacturer's instructions. University Hospitals responding to these issues and more on the right-hand column, where they detail new remote alarm systems with a 3-tiered chain of people receiving notifications, new policies and procedures for maintenance checks, documentation, and remote monitoring, and 4 brand new liquid nitrogen tanks for egg and embryo storage. But in their correction, UH is also pointing a finger at Custom Biogenic Systems, their storage tanks manufacturer, when they say they provided a recommended maintenance, but say there were no recommendations regarding the frequency of such maintenance, and claim that when UH asked the manufacturer, Custom Biogenic Systems, following the March 4th incident to provide recommended frequencies, the manufacturer declined to do so. And states that staff notified Custom Biogenic Systems and was told to manually fill the container with liquid nitrogen due to the malfunctioning sensor. But when News 5 traveled to Custom Biogenic's headquarters earlier this month, we were told something completely different. In a statement, the company claimed, quote, the CBS tank is not designed to be filled by liquid nitrogen being poured into the top of the tank, as UH admits it was doing in its letter. The CBS product manual states, quote, important. It is not recommended to attempt to manually fill the isothermal storage unit by opening the lid and placing a fill line over the edge into the vessel. This is an incorrect fill method and will cause liquid nitrogen to come into contact with the stored samples. We requested a comment from University Hospitals on their compliance. Their PR team sent us an email, declining an interview because of the pending litigation against them, but, quote, while we investigate why this happened, we are also taking action to improve our operations at the fertility clinic, including upgrading equipment at the lab with new tanks, alarms, and remote monitoring. We hired additional embryologists, nurses, and support staff to assist in the transition to the new equipment and processes. Now, guys, the end of this letter says that now that the hospital is meeting all requirements, the Department of Health will stop doing monitoring surveys. I reached out to them to see if that means they won't check back in on UH. As soon as I get that information, we'll report it to you. Reporting in Cleveland, Tara Molina, News 5.